We are going to be talking about wellness during and after cancer. So what is, see, this is what happens. So what is wellness? Well, according to Google, it's the act of practicing healthy habits on a daily basis to attain better physical and mental health outcomes, so that instead of just surviving, that we're thriving. And this can include a variety of things: nutrition, our sleep, stress management, hydration, exercise, etc. For the purpose of this talk, we are going to focus on exercise. We'll go through a little bit of the background, sort of the research. We won't deep dive into the research, but I want you to know a little bit about where this information comes from. We'll talk about some specific things to consider, and then we'll get into some more formal exercise guidelines and things that we need to think about, both with treatment as well as for survivors. So the research, the American College of Sports Medicine is an organization that helps to develop guidelines for both the general population as well as special populations. They and the American Cancer Society meet on a regular basis, and they have consistently over the last 15 years. And they look at all the research out there. How much is one thing helping more than others? Most recently, they met in 2019, and they looked at how exercise can benefit those with both existing disease as well as survivors. In 2012, there was evidence to support exercise as a therapeutic intervention for survivors, that it actually offered benefits such as improvements in physical function, strength, fatigue levels, quality of life, and possibly the recurrence in survival. So basically said virtually all individuals with cancer can benefit from exercise, and that they should in fact avoid inactivity, and some activity is better than none. However, we need to make sure that we're doing so safely. So this is a very detailed slide, but this is a summary of what they found in 2019. When they met again, they included even more health professional organizations. Again, it was led by the American College of Sports Medicine and American Cancer Society, and they evaluated the supporting evidence and found even more evidence in cancer prevention and exercise and treatment recovery, and worked to further develop the formal guidelines. They found significant evidence to support exercise as an assist in prevention and treatment, and showed that there was a link in lowering risk in developing specifically colon, breast, and lung cancers. They found that there was a very strong relationship between exercise and cancer-related health outcomes, specifically anxiety, better quality of life, and less fatigue. At this roundtable, the research was to be so substantial that they were actually quoted as saying, if there were a drug with a similar benefit profile as exercise, it would be prescribed broadly. To go a little bit further on the recommendations, they found that those with recurrent localized disease, exercise should focus on maintaining strength, endurance, and level of function. So that should be the overall goal of starting the exercise program. For survivors, exercise should focus on returning to prior level of function, both physically and psychologically. And those with recurrent or metastatic disease, the goals of exercise really need to be tailored to a current level of function. Before you begin an exercise program, though, you need to make sure that you're getting clearance from your physician to make sure that it's safe for you to start exercising. It is sometimes recommended that you start with a physical therapist prior to either joining a gym or starting an exercise program at home to make sure that you're addressing other limitations first. The National Comprehensive Cancer Network recommends that patients with any comorbidities, recent major surgeries, functional or anatomical deficits, that they start with a physical therapy to facilitate exercise, especially if there's significant fatigue. I think, Shannon, you can correct me if I'm wrong, but I think in the past you've had talks from both Jamie and Ann Frost, who are both physical therapists in the area that specialize in some of these areas mentioned. However, I did want to still touch on a few of these things. So for lymphedema, it's advised that you started with a physical therapist to make sure that you're getting the lymphedema under control, but that actually it might be recommended that you wear a sleeve while performing exercises, or that you might have a lymphatic drainage routine that you perform prior to doing the exercises. With any range of motion deficits, and this can occur from just disuse or lack of movement, or with certain surgeries, and we start to develop scar tissue, you can have a significant amount of range of motion deficits, which will further limit your ability to exercise. So starting with a physical therapist can help identify some area exercises within the range of motion that you have, or can help to correct some of the range of motion. Other things, any abnormal breathing patterns. With certain treatments, we start to develop scar tissue, or again, with disuse, we lose the ability of our ribs to expand. Normal breathing is just a pressure change. However, if we take a deep breath, our ribs should expand to get more air in. And so with certain treatments, we get scar tissue and we can limit how much our ribs are expanding. So you might start with a physical therapist where they would work on some posture education, deep diaphragmatic breathing. There's some resisted breathing techniques or pursed lip breathing, and overall energy conservation techniques to help with that breathing pattern to allow you to exercise safely. If you have any sort of neuropathy, especially with chemo-induced neuropathy, you lose the protective sensation on the bottom of your feet. You start to get tingly in the feet and the legs. And that can actually hinder the ability to perform exercises safely, but also increases your fall risk. So starting with physical therapy to help address that. And sometimes people ask me, well, what are they going to do for the numbness and tingling? And there's some research, actually a decent amount of research, that supports balance training and performing balance exercises can improve neuropathy. And also might take you through just some safety parameters around, if you don't have the ability to feel in the bottom of the feet, some things that you might do with exercise to make sure that you're exercising safely. And then any pain at the surgical site, you might be learning exercises to put less stress in that area. Sometimes shorter arc motions, exercises that aren't going through as big of a range, or maybe fewer reps and sets. And then any sort of substantial deconditioning should likely start with a physical therapist to make sure they're monitoring vitals and symptoms, make sure you're exercising safely. Further considerations before we get going: any bony metastases, any current vomiting, pain, diarrhea, fever, thrombocytopenia due to the increased risk of bleeding, anemia, or active infection. Now that's exercising while these are present. Once they're under control, is safe, and it's safe to resume an exercise program, it's still recommended that you are starting with a very low intensity exercising, such as walking, stationary cycling, flexibility exercises, before we would progress to more advanced exercises. So you're asking, what are the recommendations? Well, the still exact recommendations are not known. There does appear to be a dose-response relationship, with less fatigue experienced in those who exercise at least 10 minutes a day and at least every other day, meaning the more you exercise, the more benefits have been shown. The American College of Sports Medicine did go further into describing, after that last roundtable discussion, a little more specifics. Now, these are goals. This is not where you're starting out. They found that inactivity, it needs to be avoided. You're going to aim for 150 minutes of moderate exercise per week and include strength training 2 days a week. Now, this is very similar to the exercise recommendations that AACSM has for the general population, which is great, meaning we can work to get there, but we definitely don't want to start there. And we still want to make sure we're including flexibility exercises and functional training. So good news is we're working towards this, however, still need to think about some specifics. For aerobic exercise, it's recommended to aim for that 40 to 60% intensity. And in parentheses, I have their heart rate or VO2 max. It's very hard to know your VO2 max unless you're working in an environment such as Cal Poly, where you can, or somewhere where they can test that. So we'll talk about some ways to monitor your own intensity if you're working out at home or with a personal trainer. Our goal is to get to 3 to 5 days a week of 20 to 60 minutes. So that's the goal. So where are we going to start? Things like the walking, rowing, cycling, and water aerobics are great places, are great ways to work on our aerobic exercise, sort of our cardiovascular exercise. And the goals of this is to help us to improve or maintain our work capacity, help to control body weight. The biggest thing though is to reduce fatigue, and helping to improve overall quality of life. Now, when we get into strength, when we're strength training, we want to pay attention to symptoms a little bit more. You'll see there, it says 40 to 60%. This is another form of intensity. 1 RM is 1 rep max. If you went to a gym and the personal trainer's trying to decide how much weight you use to do your bicep curls, they would see how much weight you could lift with 1 repetition maximally, and then they would take a percentage of that, and that would be the amount of weight that you would use with your exercise. But that's really hard for all of us to figure out at home, or if we're working out on our own at the gym. And so what a general recommendation is, however many reps and sets you're going to do, by that last set, you should barely be able to keep good form. For instance, if I'm doing 2 sets of 5, by the time I'm getting to that second set, last few repetitions of 5, it's going to be a little bit hard for me to control good form. And that way, you know, you're doing a good weight. If you can bust out 20 of them, no big deal. You need to up your weight a little bit. Now, the ACSM guidelines did say 2 to 3 sets of 8 to 12. Again, that's our goal. But we might start out with a 1 set of 5 or 2 sets of 5, and that's a great place to start. And I think sometimes people get so focused, oh, I need to do on all this exercise, it's recommended I do this, but those are the goals. That's where we're working towards. But I think starting out at 1 to 2 sets of 3 to 5 is a great place to start. That RPE is a rate of perceived exertion. How hard are we working? And I'll have in a subsequent slide, a sort of a guide on that you could use. But these numbers correlate to the heart rate, and all it is how hard are you working? So it's a range from 6 to 20. That 11 to 13 means we're working decently hard, not too much, but not too little either. And so you could, I'm going to send this to Shannon, she can send it to you. This is the range that when you're doing your weights or where you're doing your walking, that you can use to make sure that you're exercising at an appropriate level. When you're starting out with strength, you want to work on major muscle groups. And these are like the front of your arms, the back of your arms, your biceps, your triceps, your quads, and your legs, your buttock muscles, the calves. These are big muscle groups that help to really boost endurance and energy. So you want to start with those sort of major muscle groups, pick 5 or 6 exercises that you're doing overall, and those are the big muscle groups, and you're starting there before you get into the finer muscle groups. And the goals of this are to maintain your strength in your arms, legs, and trunk, and then you're increasing contraction and power. Now, oftentimes people think power is like the football player coming off of the line. It's not. Power is your ability to go up and down stairs, your ability to get off the toilet, your ability to hike the mountain. Power can be a variety of those things. It doesn't have to be you taking off on a sprint on the track. And then examples of resistance exercises include free weights, machines, resistance bands, and circuit training is just where we might do 1 set, but you're doing multiple muscle groups, and we're doing a little circuit. Another good way to modify days that we're not feeling as great, you sit in a chair and you're doing 1 set of 5 on the bicep curls, or you're using a band sitting in the chair and you're doing some marching where you're lifting 1 leg and the other. And then next week I feel I have more energy, so I'm doing those same exercises but in standing. So like we talked about previously, a little activity is better than none. And just make sure when it comes to strength training, we're really paying attention to symptoms and how we're feeling. And if it's a day that's not going as well, we do less, but we're still doing something because of the benefits that research has shown as far as the fatigue level and helping in a variety of ways. This is also a short, sweet version that I will send to Shannon that she can pass on to you all. This is everything that we just talked about on what our goals are, shooting towards those major muscle groups. Some tips to remember: performing an exercise slowly. So all resistance exercise should be done slow and controlled. We don't want to be powering through exercises. So specifically when we're lowering, if you lift something up and as you're lowering it back down, it's done very slowly. The way we breathe is you take a breath in and then you're exhaling as you're performing the resistance. So if I'm lifting up the weights, I take a breath in and then I exhale as I'm curling the weights. I thought this bottom chart was sort of fun because not all of us love to go to the gym and lift weights or even lift weights in our home and have a treadmill. So these are day-to-day activities that the American College of Sports Medicine put together that is broken down into light, moderate, and vigorous activity. What our goal is based on that first slide is to get to that moderate intensity phase. But it sort of shows you some things that are on that lighter intensity. And then if some of those things on that vigorous activity are things that you'd like to get back to, sort of tells you how hard do you have to be working and getting into those categories. I'm also going to send this one. We talked about the heart rate and how to, this shows you how to find your own heart rate. So both slightly below and forward from the ear as well as in the wrist. You can write that number down and then you would take the percentage. It tells you how to get your max heart rate and then you would take a percentage of that. I think that's complicated. I think especially when exercising, people don't either know or don't like to follow that. So there's this really nice thing called the talk test. The talk test I use all the time. I still in here will monitor somebody's blood pressure and heart rate and oxygen saturation and use that RPE scale. But at the end of the day, if somebody cannot have a conversation with me while exercising, then we need to slow it down. So that's something that you guys can use on how intense the exercise program is. Do you need to, and if you need to take a rest, if you definitely can't have a conversation, it's time to take a break. I see there's something in the chat. Is that something for me?
No, that's just me giving them an email address that they can ask for these slides that you are offering.
Oh, got it. Thank you.
You're welcome.
Oop, go back. So this is that RPE scale. You can find this if you Google RPE, rate of perceived exertion, you can print one off. That 11 to 13 is where we want to be working towards. This sort of correlates to that talk test too. If you're working higher than a 13, it starts to get a little bit difficult to have a conversation. Really, when you get into that 16, 17, 18, a fun way to sort of monitor your activity that people have used is taking the minutes that you do an exercise and then multiplying it by this number. And there's exercise physiologists that have started to use this with their elite athletes, as well as the general population. And what you would do is you would take a calendar for your week and say I did a yoga class and I was working at a 10. That number would be 600. So you take your 60 minutes times your 10, and that on Monday morning, I had a 600. And then the next day I went on a 10-minute walk and I thought that I was working around a 13. Then there's 130. Basically what you're looking at is throughout all your activity, you want to make sure that you're giving your body a break. So you don't want to be working at high numbers every day. So if you took your calendar and you see that, man, every day this week I was between 500 to 1,000, well, maybe you need to start to dial in some days where you have less numbers. And everybody's numbers are going to be different. Some people might average around the 100 to 300. Some might average around the 500 to 1,000 and then above. But it's just a great way that each one of us can keep track of our daily activity and how hard were we pushing ourselves. So just sort of a fun, easier way than talking about our blood pressure and our heart rate and things like that. How are you doing so far? Did I lose anybody yet? Everybody's still here. And then getting into flexibility. Most of the time people think about flexibility as just stretching, but we'll talk about it a little bit in the sense of mobility as well. So mobility is sort of the joints moving a little better. Flexibility is typically our soft tissue, our muscles and our ligaments moving a little bit better. The goal of the flexibility is to make sure we're increasing or maintaining range of motion, but really to decrease the amount of stiffness from disuse. So if you don't use it, you lose it. We even have, our physics law where an object in motion stays in motion. So we want to make sure that we keep moving. This allows increased blood flow. It allows the joints to be lubricated, the synovial fluid in the joint. The more we're moving it, the more sort of lubricating the joint, if you will. So the flexibility exercises, these are the ones that can be done almost every day, where you're holding for, a 20, 30 seconds per stretch. There's various recommendations on their repetitions, anywhere from 2 to 4. I think 4 is quite a bit. Typically, I think we do more of a 1 to 3, but it's important to keep things moving. And then when we get into functional, these are definitely the things we can perform every day with the goals of maintaining as much independence as possible, improving gait, our walking patterns, and improving balance. I would say that balance is the biggest one in this category. The ability to balance is multifaceted. It involves our vision. It involves the inner ear, the vestibular system. There's sensors on the inner ear, that helped us to detect balance, as well as knowing when we're accelerating or decelerating, the ability to catch ourselves if we start to fall. Other things that play into balance is the strength of our legs, the strength of our core, the sensation in the bottom of our feet. So that's where the neuropathy comes in. There's sensors in the joints, both the knee and the ankle, that also helped us to detect balance. And if any one of those systems is starting to decline, the others need to work harder. So we don't fall over, so we don't increase our fall risk. So to improve balance, we have to challenge the system. So balance exercises are important for us to be doing each day. That tandem stance there is specifically just one foot in front of the other. So if we're standing at our kitchen sink, great spot to do balance exercises is the kitchen sink, because it's tall and it's sturdy. I don't really love people doing balance at a chair, because chairs can fall over, a quick turn to the side and we lose our balance. I think the kitchen sink is a great spot. So that one foot in front of the other helps us to mimic a walking pattern. When we walk, one leg slightly goes behind us, one leg slightly goes in front of us. And that narrows our base of support. And that's on a sturdy surface can help and we can start to lose balance. So I think practicing that one foot in front of the other balance is important. I also think single leg stance is important. There are numerous times throughout the day where we're only standing on one leg. You go to step over a tub into the shower, you go to get into the car, you go to step up a step or up onto a curb. There's that period of time where you're only standing on one leg. So it's important for us to practice standing on one leg. And this can be 3 seconds, this can be 10 seconds, this can be 30 seconds. And then that NBOS is narrow base of support on foam. So if you have a yoga mat that you fold in half, or even a bath towel that you fold and you stand on that with your feet really close together at the kitchen sink, that uneven surface helps us when we're walking on sand, gravel, grass, especially if we don't have the protective sensation in our feet because of neuropathy. That balancing on uneven surfaces is really important to help decrease our fall risk. And then they've actually shown that balance exercises can help to improve the strength in our legs. This is that calendar I was talking about. The American College of Sports Medicine developed this, and it's just, where do we find the time? We all have a variety of things, whether that be work or doctor's appointments and our yoga class and time that we spend with loved ones, and sometimes it's hard to find that 10 minutes a day. So I always think that this is a neat calendar to just sort of shade in and pencil in, where am I going to find my 10 minutes? So now I want to get into some sort of disease-specific guidelines. As far as the exercise with breast cancer, the biggest thing that research has shown, and actually this is probably the area where most of the research is around, avoiding inactivity. The great news is that the overall goals are consistent with the regular exercise guidelines, meaning we can get to, the goal is to get back to that 150 minutes a week, 2 days a week of strength training. We do need to make sure that we're being cautious with any lymphedema, and again, making sure that you're either using a sleeve or going through a lymphatic drainage program, range of motion program of the arm prior to doing exercises. But a lot of research showing the benefits in regards to fatigue, sleep disturbances, pain, and quality of life. With prostate cancer, again, avoiding inactivity is key, and engaging in the physical activity guidelines that ACSM had put out. We also want to make sure we're including weight-bearing exercises and adding in pelvic floor or Kegel exercises. With lung cancer, these patients may benefit from a lung fitness program. And these are some of these things we talked about as far as the rib expansion and resisted breathing. But a lot of postural education, depending on what types of treatment, you can develop some scar tissue or the limited ability for ribs to expand. So working on the ability for the ribs to expand further helps to get more air in. However, the other part is posture. With treatment in and of itself, it starts to bring us forward, where if we were sitting here slumped forward, is very hard for the ribs to expand. So just working on some posture education automatically allows the ribs to expand more, and then allows more air to get in. With head and neck cancers, we want to make sure we're adding in stretching for post-radical neck dissection pain, adding in range of motion exercises, and then also adding in deep neck flexor training. What is deep neck flexor training? Well, you have the core for the low back. Well, we also have the core for the neck too. And especially you have seen people wear like a neck brace to help give the neck extra support, where you have these really great muscles that we want to try to use as much as possible. So there are some exercises for the core of the neck, just like we have exercises for the core of the low back. Some other intervention for specific side effects. We've talked a lot about exercise as it can help with fatigue. If you are having a lot of fatigue, you want to make sure that you're starting at lower level. I think majority of the research has supported walking and yoga as far as combating cancer-related fatigue. We've talked a couple of times about lymphedema and the use of compression garments, joint pain, lots of research around yoga. Trunk stabilization exercises, which are our core exercises for the back as well as the neck. Mobility exercises, those are the ones we talked about, is not just flexibility, but the joint itself needs to move a little bit better. And then if there's a lot of joint pain present, it's recommended that you maybe start with aquatic therapy, so some water type exercises to really unload the joints before what we call a land-based program. So then there's just less pressure on the joint overall. And myofascial pain, I think, is an interesting one. That's an overall muscle pain. Oftentimes, people prescribe exercise for myofascial pain because there's a lot of research supporting it. However, they jump right into 20 minutes, 3 sets of 10, things like that, and they actually have more pain. With myofascial pain, you need to start very small, meaning the short arc motion. So I'm not moving through a real big range of motion. And this is where you start with that 1 to 2 sets of 3 to 5. You basically need to show your body and your brain that it's okay to move again. Because if you go too hard, too quick, your body's going to respond to that and actually have even more pain. So yes, with myofascial pain, research supports exercise, but you need to start very, very small to show the body that it's okay, in the brain that it's okay to move. This is a lot. All you need to know is this is a summary of all the things that we just talked about, with a couple exceptions. When it comes to colon cancer specifically, they found with resistance training, you really need to make sure that you're being careful to make sure you're not putting a lot of intra-abdominal pressure, avoiding herniation, flexibility exercises. You need to make sure that you're taking care to avoid excess abdominal pressure if there's an ostomy. With gynecologic cancers, there's not as much research on the lymphedema as far as exercise benefits when it comes to resistance training. With breast cancer, there's a lot of research around use of a sleeve and addressing the lymphedema. However, in the exercise, it in fact is very beneficial, but not as much research around the gynecologic cancers. And for the hematologic cancers, also resistance training can have some particular benefit with this population. So the short, sweet version is the exercise has a very crucial role, that we want to make sure that we're avoiding inactivity, and that a little bit is better than nothing. We definitely don't need to be going out and doing a crazy amount of exercise, especially on days that we don't feel great. It's important to do just a little bit, because a little bit, oftentimes they're finding that 10 minutes, people feel better. There's decreased side effects with treatments with that tiny bit of exercise. You really want to make sure that you are getting clearance with your physician first, and that you're taking into considerations current symptoms, side effects, your current health status, and make sure that we're starting small and building. And you have a variety of resources in the area. There's personal trainers, Pilates instructors, yoga instructors that do have a background of exercise with this specific background. And like I said before, if you're hesitant about starting, then there's all myself, Jamie, and Frost. There's a lot of resources also on the physical therapy side available. So that is the short and sweet. This is the resources there, some websites